Knock, knock, knock. I walk in. Mr. Mellon, you have orders for a blood draw from the doctor. Is that okay? Mr. Mellon says okay. I wash my hands. I put my clean gloves on. I come over to Mr. Mellon and I say, okay, well, we're going to use the proximal tube because this is the best one for blood draws because it's the cleanest. And there's no leftover gunk in there like medications or such. The blue tube is the medial. It's for more viscous medications such as chemotherapy drugs and different drugs that are more viscous. Your brownish red, or ours is orange, is for like lipids and stuff that the patient may need to receive. So I'm going to start off by getting my alcohol swab, and I'm going to clamp it off, and I'm going to remove the hub, and I'm going to clean it off with alcohol, and I'm going to start with for 1 full minute. I'm gonna clean it off 1 full minute, and then I'm gonna flush with 10 milliliters of normal saline. So I did that, discard that. Then I'm gonna draw out 10 milliliters of blood. So I draw out my 10 milliliters, and I'm gonna discard this because this may have leftover heparin, and it's just not good to use for your blood draw. Then I'm gonna draw 10 mLs of blood out, and then I'm gonna quickly get my tube, and I'm gonna put my blood into the tube. You want to be sure that when you're putting your blood into your tube that you don't hear a psst sound, because that means that causes hemolysis. That means that the blood sample will be no good. So you would want to discard that and do that again if you heard that sound. And you can actually see it in the tube. So then, after I'm done with that, then I'm going to get my heparin flush. A lot of times when you do these, you have to pull them down to break the seal and then push it back up. And then I'm going to put in my 10 milliliters of heparin to flush it out. Then I'm going to put my clamp back on. And then I am again going to take my alcohol swab, swipe the top, make sure it's good and clean for 1 full minute. Then I'm going to recap my hub site. So, and there we are. And Mr. Mellon, you did great, and thank you for participating.